I'm David Orcutt from Lake River Medical Center. I came today to formally let the board and the people in Somervell County know that Lake River Medical Center is very interested in working with or possibly partnering with Glen Medical Center. We have a wide range of specialties. We have 24-hour OR, ER, ICU. We also have an interventional cardiac cath lab. We have financial ability to come down and work with you guys in Somervell County. As I've talked to many of you guys throughout the last several months, we've heard concerns about working with Lake River Medical Center, specifically concerned that we would want to shut down the hospital, that we want to strip the hospital and send all the services elsewhere. If we can work together, that's absolutely not what we're trying to do down here. We believe, I've always done, as I've grown up in healthcare, I've always done community healthcare. I believe in bringing healthcare to communities, and I think Somervell County deserves that too. I've also heard the concern that you guys are very interested in maintaining local control of Glen Medical Center. And for that reason, we'd love to introduce you to our sister organization. It's called QHR, it's Quorum Health Resources. They manage 150 hospitals in 38 states. 50% of those hospitals are managed for government agencies, cities, counties, county authorities, district boards. And they manage over $6.6 billion in hospital revenue for those boards. They have 6 hospitals in Texas. We can certainly look at the folks if you want to meet with them. And their model is to maintain local board oversight and control. They can provide, and there's other companies out there who do these kind of things, but they can provide an outside perspective and resources, access to supply contracts, access to clinical training, help you with billing and collections, help provide standardized, audited, clear financial statements. And also, if y'all desire it, that organization will work for you. They can maintain the confidentiality. They can keep firewall of information from, if you choose not to share that with Lake Granbury or with myself, they work for your board. And if you wanted that information separate, then we would, at Lake Granbury, have nothing to do with that. I see on today's agenda that you have a proposal from Community Hospital Corporation. That's a pretty big step. Often these operational assessments are done by management firms after a selection process, and often these lead to the firm that did the assessment to be the one selected to manage the hospital. It concerns me that one firm chosen by the existing team here is the one doing the operational assessment without a competitive process and RFP, particularly when we know it's very possibly leading to them doing the management contract here. I think the combination of managing the hospital for the local board and possibly partnering with Lake River Medical Center with recruiting, providing specialists, access to local expertise and support, and access to another local partner in healthcare. I think that's, looking at that option is a good opportunity for healthcare for the folks here in Somervell County, the employees and the physicians out here. Thank you very much.
Okay, thank you, David. Any other public comments? Okay, the next item on the agenda is to receive and possibly take action on the proposal by Community Hospital Corporation. Gary, I think you've got the action on that. We have some guests here, I believe.
We do. Thank you, Bob. Our Future Alternative Committee met a couple of weeks ago. Sharon Boone and Ernie Rinke and myself met with Cindy Matthews and Mike Bowers from Community Hospital Consulting. Also Gary and Ray, the president of the meeting. What we did, we visited with them. They're a consulting firm that can, in community hospitals, that can help us or help anyone look at a situation, assess what they have, and go into any depth that someone would like to do. We had asked them to prepare a proposal on a tier type proposal that would allow us to look at the overall concepts of everything we're doing, to go in deeper where we needed to go and look and see the medical staff, the administrative staff, and also the board to see where we may want to go to look at different things, and they have prepared that for us. The first tier of it, or the first portion of it, would be a desktop situation. What I would compare that to emergency management, where you have a desktop program where you're looking at the overall things without a full-blown type situation, and that would be the first proportion that they have in that proposal. We have with us today Cindy Matthews and Mike Bowers from CHC, and I would like for them to get in deeper and let the board hear them and go through the proposal and what we may be looking at, give us opportunity to ask questions. I would encourage each of us asking questions, and medical staff and judge and the administrative staff asking any questions that will help us solve the situation. One thing I would like to comment on, Mr. Orcutt, that's the first time I've ever met him. I've dealt with a lot of different consultants, and one of the things I think you have to have a comfort level with consultants. I don't think it's necessary that you go out with proposals for 3 or 4 different consultants. If you're comfortable with them, you look at the situation. I think, one consultant doesn't bother me at all. That doesn't allow different cities to do things. So that's just a comment that I make from my behalf.
Let me second, I'd like to add something to this discussion. I visited on the telephone with the other consulting company, and I'm with Gary that I feel more comfortable with these people after visiting with him on the telephone. He sent us the information, I reviewed everything in it, but I still have more comfort with these people. I think I need to comment a little bit since David Orcutt saw the situation and visited our meeting today, and I visited with the other consulting company. The other consulting company makes their fees after the audit, and it's a monthly billing. And from my point of view, addressing a little bit of what Walter had, when they come in, they're going to be looking at the particular areas where they're going to make the most money. But since they're the wholly owned subsidiary of the corporation that manages Lake Granbury Medical Center, some of the results that they find might be tying us directly to that group. And I've carefully read this proposal, and I've listened to this is the second presentation we've heard from these people. And the relationship with Baylor Medical and with Hillcrest and Scott and White is impressive to me. And if they can help these people, I feel confident that they can help us here if we need the help. And so, again, I say I have more confidence in these people than I did the other people we visited with.
I had to leave the room, went to a big Orcutt, he was hyperventilating.
I think you nodded to Gary. And I don't know if it's the nod Gary gave him kind of made it cause him to do that.
He knows that.
But just for the record, I have visited with David Orcutt in his office because just fact finding, and he's called me on the phone 2 or 3 or 4 times. So I didn't realize he was quite as interested as he showed today.
Well, I think most people know that he's been to my office. He was there the day after this board was appointed, and I said, "You're one day late to talk to me."